thanks for being here, Dr. Johnson. Um, and yeah, so just to get started, I wanted to ask you how you got interested in medical qigong and sort of your background with that.
Sure. So I went to Chinese medicine school back in 2006 is when I started. And so as part of your education, you are required to take a Qigong course and a Tai Chi course. And I really loved the Wild Goose Qigong that I took, which is a very flowing, movement-oriented kind of Qigong. And then I had the great privilege to get access to Dr. Allen Johnson, renowned martial arts grandmaster and medical qigong person who learned in China and who taught, or rather practiced in the hospitals in China with qigong back when that was a little more common, like in the 90s or so. Not as common these days to have that incorporated, and his specialty was treating cancer patients. So I didn't complete his 4th year, which was on treating cancer, but I did do 3 years with him, which ended up being a master's of medical qigong. So you not only learn how to regulate your own energy, and that's so important in our practice of Chinese medicine as practitioners, but also how to treat patients with medical qigong. So if people don't understand what that is, basically qigong is energy skill. So it's about balancing and working with your own energy. And then if you apply it in this particular system, it's about balancing and helping the patient regulate, purge, and tonify their own energy, both through giving them homework exercises, maybe leading them through meditations, and also showing them physical exercises, which are part of the homework, or you're actually doing things like raking the energy field and putting energy into the different organs. And basically you're working with universal energy. It's not your energy, but you're like the conduit for that. So in that way it's similar to Reiki, but it's a little more active. You're doing a lot more, whereas Reiki is a little more quiescent from my experience.
I wanted to unpack a little bit what you said. So you're saying as recently as the 90s, they were doing medical qigong. Was that in China?
Yeah, in
Okay.
China, in Chinese hospitals.
Oh
So
wow.
in China, from my own experience, folks, there's like TCM hospitals, but the
Hmm.
practitioners who practice there are also doctors. And
Hmm.
then there's Western medicine hospitals that solely do Western medicine. So when you're a TCM doctor and you also do Western medicine, they have different specialties, usually on different floors. And so in this particular hospital or hospitals that he worked in, they would have a floor for, cancer
Hmm.
recovery with Qigong and treatment with Qigong.
Wow. So so on the oncology floor in the hospital, patients would be receiving both Western sort of standard treatment for cancer and TCM, perhaps herbs, along with medical qigong.
That's my understanding, and probably a little less um, on the Western treatment side, actually, was
Oh
my
wow.
understanding.
Hmm.
But yeah,
Hmm.
and we know that in the West, we treat the side effects of cancer as primary care providers. So it may be of what they were doing there as well. Like you're saying, if they went and had surgery for a cancerous tumor, and then they went to that ward in the hospital, and then they were recovering. So basically they didn't recur with that cancer. So you got to build the body after, it gets killed with chemo or the tumor comes out. And in Qigong, the idea is that the tumor is the Jing, the very physical, dense manifestation of cancer. And then there's an energetic manifestation, or like a blueprint that influences the physical one. And that's kind of the Jing Qi Shen idea. And so if the tumor is removed, which is the physical manifestation, then there may still be an energetic imprint there, like a blueprint, where it could grow again. And so that's how they explain the phenomenon of when cancer grows back in a patient. We might explain it in more Western terms of, oh, there's still rogue cancer cells, or the body's still weak, or the
Hmm.
person has genetic tendencies. But in medical Qigong, that's how they explain it. So they were working undoubtedly on removing that energetic blueprint so that it didn't recur, which is a very important part of cancer treatment.
That's amazing. I mean, and even from a Western perspective, we could look at it as the epigenetic conditions that gave rise to
Mm,
that cancer um, is still present in the body, and I think that, you know, like yeah, like you said, we can explain it in terms of physical terms, and then there's that energetic component. Perhaps the possibility for that disease is still present in the quantum field, and if you can shift that, then you can produce these changes on the physical level. But the energetic blueprint is sort of what gives rise to manifestations, right, on the physical level. Um, I think that's really interesting. What was your perhaps either through your own experience or through your teacher's experience of offering qigong, medical qigong to patients that have undergone chemotherapy? Um, do you have any experience with how it might have helped with the recovery, or um, perhaps prevent relapse, or even again, that's super important piece, right? The Shen, like just help them um, undergo the, you know, as we say in Chinese medicine, right? We treat poison with poison. So something that's very strong and damaging, like cancer, is treated with very strong Western pharmaceuticals, poison.
absolutely. And of course, that's very damaging in Chinese medicine to what we call the zheng qi, the righteous or upright qi, which is in contrast to the xie qi, or the evil or pathogenic qi, basically. So what we're always trying to work on in Chinese medicine, in my point of view, which may be somewhat more classical than a more modern approach, is that we need to build that zheng qi back up. And so sometimes we hear in our field about, oh, you shouldn't so-called tonify in those kind of conditions when there might be some pathogenic influence still. And in my opinion, it's about how you go about doing that. And to me, that's so-called tonify or support the zheng qi, because without that, and this very much plays into what's going on in the world right now, um, that intelligence in the body's intelligence, the innate intelligence of the body, the so-called immune system, which is part of the zheng qi, which is like the wei qi part of it, is so important. You know, we can try and kill things and kill things and kill things with herbs or with Western medicine, but if there's always a delicate balance and always the consideration of what is the state of the zheng qi, because, and then what is the state of the pathogenic qi, and then how can we both support the zheng qi and expel the pathogenic qi. But really, to me, the pathway into it is you've got to support the zheng qi, because it knows exactly how to expel that pathogenic qi. Our perception of that is not always as clear, I don't think, as it could be. So if you can work on bringing the zheng qi up to snuff, then it will help expel any pathogenic qi. And what I've experienced most is just treating the kind of depletion of the body and the essences, and therefore the disturbance of the Shen after chemotherapy. If you've seen someone who's undergone chemo, they look often very gaunt, very pale, very dull, and their eyes tend to have the same thing. And so in Chinese medicine, what we're looking for is the luster and the sheen and the aliveness. The state of the Shen is very important in prognosis. If someone has good Shen, the luster, the brightness, the aliveness, their prognosis is much better. If it looks like many people look after chemo, they have a poor prognosis. So a lot of what we have to do is work on treating the Shen. There's various ways to do that, and one of them is to support the essence energy of the body, that kind of substance which houses the Shen, whether we call it the blood or the essence or the yin qi or whatever. They all play a part in that. They're the yin part to the yang part of the Shen, which is a ethereal kind of energy. It kind of anchors it and helps it be nourished. And so that part of it is coming in with that. So supporting the digestion, what's the person eating, giving them herbs, supplements, etc. That's a very physical or earthy way of approaching it. And then the heavenly way of approaching it is to treat the Shen through different activities, meditations that are going to support that person's resourcefulness inside of them, and supporting kind of like the who they are, who they really are, and just a lot of support, a lot of supporting that person.